And now we came to the second part of our lecture, which is Ecoblics and tocolytics. The contents here are drugs affecting uterine contractility, which is Ecoblics, and drugs affecting uterine relaxation, which are named tocolytics. First of all, the drug affecting uterine muscle contractility. The drugs producing uterine contractions are called oxytocic drugs. And there are different kinds of the oxytocic drugs, such as Oxytocin, which is named Syntocinon, Ergot alkaloid, Ergometrin, or Ergonovin, and Prostaglandin, Prostaglandin E2 and Prostaglandin F2 alpha. What about the synthesis of oxytocin? Is a posterior pituitary hormone secreted by the posterior pituitary gland, and the secretion occurs by sensory stimulation from cervix, vagina, and from suckling at breast. Here is a diagrammatic presentation showing the pathway originates from the hypothalamus, the senses, and then goes the hormone oxytocin goes to the posterior pituitary, makes stimulation and stimulus to the uterus, either the uterus or myoepithelial cells. The uterus makes uterine contractions, and myoepithelial cells for milk ejection. Here is a diagrammatic presentation of the uterus indicating the body and the cervix. You see here the body consists of the fundus and the myometrium. Actually, the uterus are composed of the thickness, the thickness composed of endometrium, myometrium, and the serosa. The uterus as a whole consists of body and cervix. The cervix is composed of internal os, external os, cervical canal, and fornix of the vagina, because there is a lateral fornix, anterior and posterior fornices. Concerning here is the reflection of the peritoneum. You see here on the side of the uterus, and also we see the ovarian ligament. This is a cut, and also the fallopian tube, and also the round ligament on the upper posterior anterior surface of the fundus laterally. There are, of course, two round ligaments, right and left. What are the pharmacokinetics of oxytocin? What about absorption, metabolism, and excretion? Actually, the oxytocin is not effective orally, and that's why it is administered intravenously. Also as a nasal spray, impaired milk ejection, not bound to plasma protein and catalyzed by liver and the kidney. Actually, its half-life is 5 minutes. That's why it is of very rapid response. What's the role of oxytocin on the uterus? It stimulates both frequency and force of uterine contractility, particularly of fundus segment of the uterus. These contractions resemble the normal physiological contractions of the uterus. Contractions followed by relaxation. Why contractions followed by relaxations? To make the contractions and followed by relaxation for the relief of the muscle itself. Because when the contractions is sustained, sustained here, maintained, and that's why exhaustion happened. Immature uterus is resistant to oxytocin. Contract uterine smooth muscles only at term. Sensitivity increases to 8-fold in last 9 weeks and 30 times in early labor. Clinically, oxytocin is given only when uterine cervix is soft and dilated. Don't ever give oxytocin when the uterine cervix is hard or not dilated. These are prerequisites which must be fulfilled for giving oxytocin. What is the mechanism of action? The interaction of endogenous or administered oxytocin with myometrial cell membrane receptor promotes the influx of calcium from extracellular cell and from sarcoplasmic reticulum into the cell. This increase in cytoplasmic calcium stimulates uterine contractions. This is here the idea. What are the therapeutic uses of oxytocin? First of all, induction and augmentation of labor through the slow intravenous infusion. What are the indications here? Mild preeclampsia, uterine inertia, incomplete abortion. I mean, all those are the situations in which inductions and augmentation of labor augmented by the use of oxytocin. And that's why those are the indications: post-maturity and maternal diabetes. Those 5 indications must be also kept in. Second, postpartum uterine hemorrhage, intravenous drip. Ergometrin is often used. Impaired milk ejection, 1 puff in each nostril, 2 to 3 minutes before nursing. What are the side effects? Maternal death due to hypertension, uterine rupture, and fetal death, ischemia. Second, water intoxication. And that's why we must give a very minimal doses for avoiding the side effects. What are the contraindications? Hypersensitivity, prematurity, abnormal fetal position, evidence of fetal distress, and lastly, cephalopelvic disproportion. What are the precautions which must be fulfilled? Multiple pregnancy, previous C-sections, and hypertension. What about Ergot alkaloids? It is like ergometrine, ergonovine, and methyl ergonovine. What are the effects on the uterus? Alkaloid derivative induce tetanic contractions of the uterus without relaxation in between, not like normal physiological contractions. It causes contractions of the uterus as a whole, that's to say fundus and cervix, tend to compress rather than to expel the fetus. Difference between oxytocin and ergots is actually quite clear. Ergot alkaloids, absorption, fate, and excretion. Absorbed orally from GIT tablets, usually given intramuscularly, extensively metabolized in the liver. 90% of metabolites are excreted in bile. What are the clinical uses? Postpartum hemorrhage, 3rd stage of labor. When to give it? This is at the timing of the 3rd stage of labor. Preparations: Syntocinon, ergometrin, 0.5 milligram, plus oxytocin 5 international unit, and is given intramuscularly. What are the side effects? The side effects mostly GIT, gastrointestinal, ranging between nausea, vomiting, diarrhea, and also systemic, like hypertension. Also vasoconstriction of peripheral blood vessels for the terminal, like toes and fingers. And lastly, gangrene because of the inadequate blood supply which reaches the tissues. What are the contraindications? Induction of labor, 1st and 2nd stage of labor, vascular disease, severe hepatic and renal impairment, and lastly, severe hypertension. Those are the contraindications and must also be kept in mind. Prostaglandins, prostaglandin E2 and prostaglandin F2 alpha. What are the therapeutic uses? Induction of abortion, pathological of course, induction of labor, fetal death in utero, and postpartum hemorrhage. What is the difference between prostaglandins and oxytocins? Prostaglandins actually contract uterine smooth muscles not only at term as with oxytocin but throughout pregnancy. Prostaglandins soften the cervix, whereas oxytocin does not. Actually, oxytocin, when given, it must be given to soft cervix, unlike prostaglandin. Prostaglandin have longer duration of action than oxytocin. What are the side effects? It is also GIT, nausea and vomiting, abdominal pain, diarrhea, bronchospasm, especially when using prostaglandin F2 alpha, and flushing when using prostaglandin E2. What are the contraindications? Mechanical obstruction of delivery, fetal distress, predisposition to uterine rupture. Precautions must be given: asthma, multiple pregnancy, glaucoma, and uterine rupture. What are differences between oxytocin and prostaglandins? Actually, at the level of contractions and at the level of the cervix. Concerning contractions, when using oxytocin, it is only a term, prostaglandin contraction throughout pregnancy. Why here a term? Because the cervix is soft. But unlike prostaglandin, it can be used actually wherever the cervix is soft or hard. The cervix does not soften the cervix. I mean the oxytocin does not soften the cervix. And that's why it must be used on soft cervix. But prostaglandin do. It softens the cervix. And that's why it can be used all through pregnancy. What about the duration of action? Concerning oxytocin, it's shorter. Concerning prostaglandin, it is longer. What are the uses? Induce and augment labor and postpartum hemorrhage. Concerning prostaglandin, induce abortion in the second trimester of pregnancy. Used as vaginal suppository. It can be also used as abortifacient in the first trimester. Also used as a vaginal suppository for induction of labor. Why vaginal suppositories? Because the vaginal suppositories, it is much lower dose than the dosage used during induction of abortion, whether in the second or the first trimester of pregnancy. What are contractions of oxytocins? Resemble normal physiological contractions, but contractions of ergometrine, tetanic contractions, does not resemble normal physiological contractions. Here, the comparison between oxytocin and ergometrine. So, at the level of contractions, uses, and onset of durations. What about uses? Uses of oxytocin to induce and augment labor and also postpartum hemorrhage. Concerning ergometrine, it is only in postpartum hemorrhage. It is not used to induce and augment labor. What about the onset of duration? The oxytocin is very rapid onset and shorter duration of action. Unlike ergometrine, it is moderate onset but longer duration of action. Now we shift to the uterine relaxant or the tocolytics. This is the tocolytics drugs, actions and uses. Relax the uterus and arrest threatened abortion or delay premature labor. Beta-adrenergic receptor agonists like ritodrine hydrochloride, intravenous eye drip, intravenous drip, selective beta-2 receptor agonist used specifically as a uterine relaxant. Beta-adrenoreceptor agonist. What is the mechanism of action? Bind to beta-adrenoreceptor, activate enzyme adenylate cyclase, increase in the level of cyclic adenosine monophosphate, reducing intracellular calcium. What are the side effects? Tremors, nausea and vomiting, flushing, sweating, tachycardia when used, of course, in high dosages, hypotension, hyperglycemia, and hypokalemia. Second, calcium channel blockers, e.g. nifedipine, causes relaxation of myometrium, markedly inhibits the amplitude of spontaneous and oxytocin-induced contractions. Unwanted effects: headache, dizziness, hypotension, flushing, constipation, ankle edema, coughing, wheezing, and lastly, tachycardia. Third, prostaglandin synthetase inhibitors. This is actually under the grouping of anti-rheumatic, anti-inflammatory drugs. The depletion of prostaglandins prevent stimulation of the uterus, like non-steroidal anti-inflammatory drugs, e.g. indomethacin, aspirin, or acetyl salicylic acid, and also like ibuprofen. Adverse effects: ulceration, of course, ulceration in the stomach or affecting gastric mucosa, premature closure of ductus arteriosus, and that's why is not used starting from the 31st week of gestation, unlike Fallot's trilogy or Fallot's tetralogy will issue. Questions. And now we came to the end of this lecture. What about the questions? Give short account on tocolytics and give short account on Ecoblics. Thank you very much.